Question 1. A postoperative client becomes dizzy when standing for first ambulation. The nurse must decide whether to continue. What is the safest clinical judgment? A. Continue ambulation with two-person assist. B. Return client to bed and reassess orthostatic vitals. C. Give PRN opioid for presumed pain. D. Encourage client to push through to prevent complications. Answer. B. Return client to bed and reassess orthostatic vitals. Rationale. Dizziness may indicate orthostatic hypotension or hypovolemia. Continuing to walk risks a fall. Pain medication C. Can worsen hypotension, pushing through. D. Ignores physiologic warning signs. Two-person assist A. Does not correct the underlying problem. Question 2. During skin assessment, the nurse notes non-blanchable redness on the sacrum. Which action shows highest level clinical judgment? A. Apply a donut cushion and document. B. Massage area to improve circulation. C. Initiate pressure injury protocol and notify provider. D. Increase head of bed to 45 degrees for comfort. Answer. C. Initiate pressure injury protocol and notify provider. Rationale. Non-blanchable redness indicates stage 1 injury requiring immediate intervention. Donut cushions A. Worsen ischemia. Massage B. Damages tissue. Elevating HOBD increases sacral shear. Question 3. A client prescribed bedtime zolpidem requests the medication at 1,900 because of poor sleep the previous night. What is the nurse's best response? A. Administer early to prevent sleep debt. B. Offer non-pharmacologic measures first. C. Hold the dose and document refusal. D. Give with diphenhydramine for better effect. Answer. B. Offer non-pharmacologic measures first. Rationale. Sedatives increase fall and delirium risk. Sleep hygiene should be attempted before altering timing. Early dosing A may cause nighttime awakening. Adding diphenhydramine D increases anticholinergic harm. The client did not refuse C. Question 4. Select all that apply. An immobile client receiving opioids has not had a bowel movement for 3 days. Which actions demonstrate sound clinical judgment? A. Initiate a bowel protocol with stool softener and stimulant. B. Increase oral fluids if not contraindicated. C. Administer antidiarrheal to prevent accidents. D. Encourage dangling only. Avoid ambulation. Answer. A. Initiate a bowel protocol with stool softener and stimulant. B. Increase oral fluids if not contraindicated. Rationale. Opioids slow peristalsis. Evidence supports stimulant plus softener and hydration. Antidiarrheals C. Worsen impaction. Limiting mobility D. Decreases motility further. Question 5. While providing perineal care to a female client with a Foley catheter, the nurse notices cloudy urine and odor. What should be done first? A. Replace the catheter immediately. B. Obtain a sterile urine specimen from the sampling port. C. Increase cleansing frequency only. D. Irrigate catheter with normal saline. Answer. B. Obtain a sterile urine specimen from the sampling port. Rationale. Assessment precedes intervention. Culture confirms CAUTI before changing devices. Routine replacement A and irrigation D without orders can introduce bacteria. Hygiene alone C delays diagnosis. Question 6. True or false? Repositioning a high-risk client every 4 hours is acceptable if a pressure redistribution mattress is in use. A. False. B. True. Answer. A. False. Rationale. Support surfaces do not replace the need for at least Q2H turning. Tissue tolerance varies, and longer intervals remain unsafe. Question 7. A client with severe rheumatoid arthritis spills food when using standard utensils. The family insists the nurse feed the client to save time. What reflects ethical clinical judgment? A. Feed the client to maintain nutrition. B. Provide adaptive equipment and allow extra time. C. Request occupational therapy only after discharge. D. Restrict messy foods from the diet. Answer. B. Provide adaptive equipment and allow extra time. Rationale: preserving autonomy and function outweighs convenience. Feeding the client, A. Promotes dependence, delaying OTC and restricting diet, D. Reduce quality of life. Question 8. Yes or no? For a client with dysphagia after stroke, should medications be crushed and mixed with thin liquids unless specifically ordered otherwise? A. No. B. Yes. Answer: A. No. Rationale: thin liquids increase aspiration risk, and some medications cannot be crushed. Swallow evaluation and appropriate consistency are required first. Question 9. A client 12 hours after ankle sprain asks for a heating pad because it feels stiff. Which decision is safest? A. Apply heat for comfort as requested. B. Continue intermittent cold therapy and elevation. C. Massage the area before heat. D. Encourage dependent positioning to improve circulation. Answer: B. Continue intermittent cold therapy and elevation. Rationale: within first 24 to 48 hours, heat increases edema and bleeding. Massage, C, and dependency, D, worsen swelling. Patient preference, A, does not override physiology. Question 10. Select all that apply. A client with COPD and dyspnea is anxious and requesting to lie flat to rest. Which actions show correct judgment? A. Maintain high Fowler and explain rationale. B. Coach pursed lip breathing. C. Allow supine position for comfort. D. Remove oxygen briefly to reduce dryness. Answer: A. Maintain high Fowler and explain rationale. B. Coach pursed lip breathing. Rationale: upright positioning and breathing techniques reduce work of breathing. Supine, C, worsens ventilation. Removing oxygen, D, endangers gas exchange. Question 11. The nurse is bathing an older adult with fragile skin who reports burning when soap is applied. What is the priority action? A. Continue bath using hotter water to open pores. B. Switch to pH-balanced, fragrance-free cleanser. C. Scrub gently to remove dry skin. D. Shorten the bath and omit moisturizer. Answer: B. Switch to pH-balanced, fragrance-free cleanser. Rationale: fragile skin is easily irritated. Mild cleansers reduce discomfort and skin breakdown. Hot water, A, increases dryness. Scrubbing, C, causes tears. Moisturizer should be used, not omitted, D. Question 12. A client on bed rest develops sudden calf pain and warmth during passive range of motion. What should the nurse do first? A. Massage the calf to relieve discomfort. B. Stop the exercise and notify the provider. C. Apply sequential compression device. D. Encourage active dorsiflexion. Answer: B. Stop the exercise and notify the provider. Rationale: symptoms suggest possible DVT. Activity or massage can dislodge a clot. AD, SCDC are contraindicated until DVT is ruled out. Question 13. Which finding indicates the client's pain plan is ineffective and requires immediate revision? A. Client rates pain 6 out of 10 1 hour after IV opioid. B. Client sleeps 30 minutes after medication. C. Client requests non-pharmacologic options. D. Client reports constipation. Answer: A. Client rates pain 6 out of 10 1 hour after IV opioid. Rationale: IV opioids should reduce pain significantly within 30 to 60 minutes. Continued severe pain signals inadequate control. Others are expected effects or positive behaviors. Question 14. Select all that apply. Which interventions are appropriate when assisting a client with dentures during meals? A. Remove dentures and place in tissue on bedside table. B. Rinse dentures before insertion. C. Assess for mouth sores or redness. D. Use hot water to disinfect quickly. Answer: B. Rinse dentures before insertion. C. Assess for mouth sores or redness. Rationale: clean, moist dentures and oral assessment promote comfort and nutrition. Tissue storage, A, risks loss. Hot water, D, warps dentures. Question 15. A client with limited vision is being assisted with grooming. Which approach demonstrates best clinical judgment? A. Perform all care to save time. B. Arrange items in consistent locations and explain placement. C. Leave sharp items at bedside for independence. D. Dim the lights to reduce glare. Answer. B. Arrange items in consistent locations and explain placement. Rationale. Orientation and consistency promotes safety and autonomy. Doing everything, A, fosters dependence. Sharp items, C, are unsafe. Adequate lighting, not dim, improves visibility, D. Question 16. True or false? It is appropriate to delegate oral care of an unconscious client to unlicensed assistive personnel without nurse assessment. A, false. B, true. Answer. A, false. Rationale. The nurse must first assess risk for aspiration and oral status. Delegation without assessment is unsafe. Question 17. During transfer from bed to chair, the client's knees begin to buckle. What should the nurse do immediately? A. Lower the client to the floor using body mechanics. B. Pull the client back to standing position. C. Leave to obtain additional staff. D. Place the client back into bed quickly without a gait belt. Answer. A. Lower the client to the floor using body mechanics. Rationale. Controlled lowering prevents injury to both client and nurse. Pulling up, B, causes harm. Leaving, C, is abandonment. Moving without support, D, increases fall risk. Question 18. Yes or no? Should the nurse use warm water rather than alcohol-based products for routine perineal cleansing of an incontinent client? A. Yes. B. No. Answer. A. Yes. Rationale. Alcohol dries and damages skin. Gentle warm water or pH-balanced cleansers maintain integrity and comfort. Question 19. A client receiving tube feeding develops abdominal distension and nausea. Which action has highest priority? A. Increase feeding rate to meet daily goal. B. Stop feeding and check gastric residual per policy. C. Administer prescribed antiemetic only. D. Reposition to supine for comfort. Answer. B. Stop feeding and check gastric residual per policy. Rationale. Distension signals intolerance. Feeding must be held to prevent aspiration. Increasing rate, A, worsens problem. Supine, D, increases aspiration risk. Question 20. Select all that apply. Which actions promote comfort for a client in skeletal traction? A. Maintain body alignment with pillows. B. Release weights during repositioning. C. Assess pin sites for redness. D. Allow the client to sit at 90 degrees. Answer. A. Maintain body alignment with pillows. C. Assess pin sites for redness. Rationale. Alignment and pin care reduce pain and complications. Weights must never be released. B. Sitting at 90 degrees. D. Disrupts traction. Question 21. A client receiving morphine for fracture pain is difficult to arouse and has respirations 9 per minute. What is the nurse's first action? A. Administer the next scheduled dose early for comfort. B. Stimulate the client and prepare naloxone. C. Place the client in prone position. D. Offer sips of water. Answer. B. Stimulate the client and prepare naloxone. Rationale. Respiratory depression is life-threatening. The priority is to stimulate breathing and reverse opioid effects. Giving more opioid, A, worsens depression, prone, C, and fluids, D. Do not address airway/breathing. Question 22. Which action best prevents contractures in a client with prolonged immobility? A. Position joints in functional alignment with splints. B. Keep limbs flex for comfort. C. Perform them once weekly. D. Avoid pillows to maintain firmness. Answer. A. Position joints in functional alignment with splints. Rationale. Functional positioning and regular ROM maintain muscle length. Flexion, B, promotes contractures. Weekly ROM, C, is inadequate. Pillows are helpful, not harmful, D. Question 23. A client with urinary incontinence develops redness in the groin folds. What intervention is most appropriate? A. Apply cornstarch powder generously. B. Cleanse promptly and apply moisture barrier ointment. C. Limit fluid intake after breakfast. D. Use hot compresses to dry the area. Answer. B. Cleanse promptly and apply moisture barrier ointment. Rationale: moisture-associated skin damage requires gentle cleansing and barrier protection. Cornstarch A. Promotes fungal growth. Fluid restriction C. Causes dehydration. Heat D. Irritates tissue. Question 24. Select all that apply. Which findings indicate that a client is at high risk for impaired comfort related to positioning? A. Kyphosis and limited neck mobility. B. Inability to verbalize pain. C. Use of sedative medications. D. Independent ambulation. Answer. A. Kyphosis and limited neck mobility. B. Inability to verbalize pain. C. Use of sedative medications. Rationale: deformities, impaired communication, and sedation prevent self-repositioning and pain reporting. Independent ambulation D. Lowers risk. Question 25. While assisting with a bed bath, the nurse notes the client shivering. What should the nurse do first? A. Increase room temperature and cover exposed areas. B. Finish the bath quickly without rinsing. C. Use alcohol rub to warm the skin. D. Stop the bath and report infection. Answer. A. Increase room temperature and cover exposed areas. Rationale: shivering indicates heat loss. Maintaining warmth preserves comfort and safety. Alcohol C. Increases cooling. Stopping care D. Is unnecessary unless other symptoms exist. Question 26. True or false? A nurse may crush extended-release pain medication to mix with applesauce for easier swallowing. A. False. B. True. Answer. A. False. Rationale: crushing extended-release forms causes dose dumping and toxicity. Alternative formulations must be requested. Question 27. Which technique demonstrates correct body mechanics when repositioning a client in bed? A. Twist at the waist to pull the client upward. B. Keep feet apart and use leg muscles. C. Lift the client without assistive devices. D. Bend at the back while keeping knees straight. Answer. B. Keep feet apart and use leg muscles. Rationale: wide base and leg muscles prevent nurse injury. Twisting A and bending back D cause strain. Devices should be used C. Question 28. Yes or no? Should the nurse place a pillow directly under the knees of a client with peripheral arterial disease for comfort? A. No. B. Yes. Answer. A. No. Rationale: knee flexion impedes arterial flow and worsens ischemic pain. Legs should be kept dependent or neutral per orders. Question 29. A client reports 8 out of 10 pain but refuses opioid medication due to fear of addiction. What is the best response? A. Document refusal and take no further action. B. Educate about pain management options and offer alternatives. C. Tell the client addiction is rare and insist on taking it. D. Substitute the medication with a placebo. Answer. B. Educate about pain management options and offer alternatives. Rationale: respect autonomy while providing education and non-opioid strategies. Insisting C is coercive. Placebo D is unethical. Doing nothing A. Leaves pain untreated. Question 30. Select all that apply. Which actions enhance comfort for a client with an indwelling urinary catheter? A. Secure tubing to the thigh to prevent traction. B. Keep drainage bag below bladder level. C. Perform routine irrigation to prevent odor. D. Provide daily perineal hygiene. Answer. A. Secure tubing to the thigh to prevent traction. B. Keep drainage bag below bladder level. D. Provide daily perineal hygiene. Rationale: these measures prevent pulling, reflux, and infection. Routine irrigation C is not recommended without an order. Question 31. During evening rounds, a postoperative client tells the nurse, "My pain is okay, but I feel really nauseated from the medication." The client is due for the next opioid dose. What is the nurse's best action? A. Administer the opioid with an antiemetic at the same time. B. Hold the opioid and assess pain using a standardized scale. C. Give the opioid early to prevent pain escalation. D. Tell the client nausea is expected and continue as ordered. Answer. B. Hold the opioid and assess pain using a standardized scale. Rationale. Clinical judgment requires reassessing the actual need for opioids when adverse effects occur. Giving more medication, A, C, D, without reassessment ignores patient-centered care and may worsen nausea. Question 32. A nurse enters the room of an older adult and finds the client sitting in a wet incontinence brief. The client states, "I didn't want to bother anyone." What should the nurse do first? A. Clean the client and apply a moisture barrier. B. Explain the importance of calling for help. C. Check the skin for breakdown. D. Document non-compliance with toileting. Answer. C. Check the skin for breakdown. Rationale. Assessment comes before intervention. Prolonged moisture can cause injury. Skin must be evaluated prior to cleansing or teaching. Question 33. Select all that apply. A client with chronic back pain asks for non-drug comfort measures while waiting for the provider. Which options are appropriate for the nurse to offer? A. Guided breathing exercises. B. Application of a warm pack for 20 minutes. C. Complete bed rest in supine position. D. Gentle repositioning with pillow support. Answer. A. Guided breathing exercises. B. Application of a warm pack for 20 minutes. D. Gentle repositioning with pillow support. Rationale. These measures reduce muscle tension and pain. Strict supine bed rest, C, often increases stiffness and discomfort. Question 34. A client with a new colostomy refuses to look at the stoma during care and says, "It's disgusting." What response shows the best clinical judgment? A. You need to learn this before discharge. B. Many people feel this way at first. We can go slowly. C. Document that the client is uncooperative. D. Ask the family to take over care. Answer. B. Many people feel this way at first. We can go slowly. Rationale. Therapeutic communication acknowledges feelings and supports coping. Pressuring, A. Labeling, C. Or shifting responsibility, D. Harms adjustment. Question 35. True or false? It is acceptable to use baby powder in skin folds to keep an immobile client dry and comfortable. A. False. B. True. Answer. A. False. Rationale. Powders cake with moisture and promote fungal growth. Moisture barrier products are recommended instead. Question 36. A client recovering from pneumonia wants to take a shower but becomes short of breath while walking to the bathroom. What should the nurse do first? A. Cancel the shower for the day. B. Apply oxygen and allow rest before proceeding. C. Encourage the client to continue to build endurance. D. Ask unlicensed assistive personnel to supervise. Answer. B. Apply oxygen and allow rest before proceeding. Rationale. The priority is to stabilize breathing while supporting independence. Canceling A may be unnecessary. Pushing through C is unsafe. Delegation D, without RN assessment, is inappropriate. Question 37. Yes or no? Should the nurse wake a stable hospitalized client at 0200 for routine vital signs when the client has a sleep promotion order? A. No. B. Yes. Answer. A. No. Rationale. Sleep is part of basic comfort and healing. Orders to promote sleep allow omission of non-essential interruptions in stable clients. Question 38. A client with a cast on the right arm reports severe itching inside the cast and asks for a coat hanger to scratch. What is the best response? A. Give the hanger if the client is careful. B. Suggest blowing cool air with a hairdryer. C. Insert a cotton swab instead of metal. D. Loosen the cast edges with scissors. Answer. B. Suggest blowing cool air with a hairdryer. Rationale. Inserting objects can injure skin and cause infection. AC. Altering the cast. D. Is unsafe. Cool air is a safe comfort measure. Question 39. An unlicensed assistive personnel reports that a client did not eat breakfast because the tray was placed on the overbed table out of reach. What should the nurse do? A. Document poor appetite. B. Ask dietary to send supplements. C. Assess barriers and arrange the environment for independence. D. Tell the UAP to feed the client next time. Answer. C. Assess barriers and arrange the environment for independence. Rationale. The issue is access, not appetite. Promoting self-care and correcting the environment addresses the true problem. Question 40. Select all that apply. A family caregiver asks how to make their parent comfortable at home with chronic knee pain. Which teaching points are appropriate? A. Use a firm chair with arms for standing support. B. Apply ice after activity if swelling occurs. C. Keep the knee fully flexed with a pillow all day. D. Encourage short, frequent walks. Answer. A. Use a firm chair with arms for standing support. B. Apply ice after activity if swelling occurs. D. Encourage short, frequent walks. Rationale. These strategies reduce joint stress and stiffness. Constant flexion, C, increases contracture and pain. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.